Hi, I'm Joseph Burks, Chief of Communications for VA Eastern Kansas Healthcare System. Today we're going to talk a little bit about Breast Cancer Awareness Month. In a second, I'm going to introduce to you Heather Jones. She's the Interim Program Manager for Women's Health at VA Eastern Kansas, and a very, very special guest, veteran named Rebecca Arthington. She's a breast cancer survivor. And while some, it just falls in October, and it's breast cancer awareness. For others, like Rebecca, it's lived every day of their life. I invite you to listen to this interview, take note, and understand why this is so important and why the community must get their screening and understand and recognize when it's time to go see your women's health provider. Let's get started. And I'm here with Heather Jones. Heather Jones is the Interim Women Veteran Program Manager. Heather, can you tell us about what Breast Cancer Awareness Month looks like?
Breast Cancer Awareness Month is such an important month, and it's so great to get this video out on social media and bring awareness, especially during COVID, and making sure that we get women to get mammograms and just educating women and men, that it's good to get checked. It's good to not put it off and just bring awareness to this cause and talk to all the veterans in our area that get care at the VA.
Thank you, Heather. And so Becky, you've got a personal story about breast cancer, and why don't you tell us what Breast Cancer Awareness Month means to you?
It means another birthday. It means another anniversary. It means just going on with life. The biggest part of October for me is just all of the pink. I love all of the pink, even though my shirt kind of is not pink, but in a general rule, it is important. It's life-saving. Some people don't even think about breast cancer until all of the pink comes out in October.
Thank you for sharing that. Heather, you could choose a lot of places to work. Why do you choose VA in this field, in this environment?
I've worked for the VA for 7 years, and it has been such an enjoyable experience. I've worked in different departments. I'm a trained social worker, and just meeting people where they're at, and it's such an honor to get to work with veterans, men and women, every day. And I have been coming to the Women's Health Center providing services for the last 5 years, and really connected with the veterans I work with and the women, and the staff here are incredible. They do and work so hard for the patients and the clients that they care for and the veterans every day. So I can't think of anywhere else I'd want to work, and it's an honor to get to work here.
That's awesome. And Becky, you're one of the veterans that we are honored to serve. Why did you choose VA for your care?
Close to where I live, the kindness, all of the kindness. My spouse, also a veteran, started coming to VA, so naturally when I retired, it was the choice. However, like Heather, and she's not in camera range, but Miss Gina really served as my go-to girl through my journey. Any question, any source, anything I needed, these two ladies made it happen.
That's awesome. And again, so honored to serve you, and that great husband of yours as well. So Heather, what's your message to not only the employees about Breast Cancer Awareness Month, what's your message to the community this October, Breast Cancer Awareness Month?
Get out, get your mammogram. Don't put it off. I know you might be feeling a little skittish about going related to COVID, but it's important to go. It's important to get tested. It's also bringing awareness, making sure that this is something we want to catch early. We want to get the message out and have people whether you're a veteran or a non-veteran, to go out and get that prevention and that treatment. It's something that sometimes people don't know that we do here in the Women's Clinic. We have 2 nurse navigators that check to see when people are due for their yearly mammograms or every few years, and they coordinate all that care. So we don't have a mammography machine here, but all of that gets sent out in the community, and they're there every step of the way making sure that you get that referral and you get that appointment and everything that you need, and the radiologist then can read it. So we are here to help you coordinate that, and some people don't know that the VA takes care of that.
It's really good information to have. And Becky, you're a survivor.
Yes, 3
And
years now.
so what do you want others to know about breast cancer awareness? Not just October, but any time of year.
Well, first and foremost, total agreement. If it wasn't for Gina, the other faculty and staff here, I might have just blown it off. I might have said, you know what, I'm really busy. I'm not gonna go this time. I'm at that time, 60 years young. Done missed it. It's not gonna affect me. But I do have a couple of other friends, later in years, and one of their biggest thing was keep a journal. Write down how you're feeling. One of the fun things in my book is I track my weight. And while I wouldn't recommend cancer as a weight loss program, I have managed to maintain 25 pounds less than when I was diagnosed. But it is important. I have grandchildren. When this whole thing started, I only had 5 grandchildren. Now I have 7, and I get to have those birthdays. I get to have the fun. I get to take vacation. So it is important. Live your life daily.
And Becky, you flashed our bear here, okay? So hold
And
him
this
up.
is his mammography sticker. This is when you go to a mammogram, they mark where the positioning and everything. And as Miss Heather stated, the mammograms are important, especially now. You are right up on each other. However, at my facility, they have new padding. Excuse me, these masks are so fun. They have new padding on the mammography machine. It goes in the trash. Totally sanitized for the next lady. So don't be afraid of COVID during the mammogram process. They will take care of you.
Great information, important information, and we just want to wrap this up with community. You don't have to wait till October to recognize.
No.
It's Breast Cancer Awareness Month. It's every single day of your life, and with people like Becky sharing their message of surviving and Heather out there to talk about our program, there's no reason whatsoever you shouldn't be getting in touch with us and getting those mammograms scheduled today.
Joe, can I say one last thing?
Absolutely.
Through this whole process, every piece of paper came from this facility. This is how you find your surgeon. This is how you find your radiologist. This is how you find what you need. You're not alone. There are so many people on your journey. You are not alone. These are the cheerleaders. Thank you.
Awesome words spoken by awesome people.